Cat with Bend and Stretch Physical Therapy, and today we're going to go over some ankle stabilization exercises. Alright, so the first one is just obvious, the most obvious, just standing on one leg, trying to find balance, and the weight equally distributed from the back of the heel towards the front. So if you're able to maintain this for 60 seconds, great, let's move on. Progressions from here is adding weight shifts. So once you're able to maintain balance equally distributed on one leg, let's start adding weight shifts, where we're going to start shifting your body weight forward. And perhaps initially you can only go to about here before you feel like you're going to collapse or lose your balance. So start with the range that's comfortable for you, and then shifting your weight back. So I'm just trying to shift my pelvis over the foot, eventually going all the way forward into a forward T position, finding your balance, and then shifting your pelvis back. So the key is to not lock your knee, keep your knee slightly bent, shifting forward, and coming back. Woo! And there you go. My ankle's already pretty tired. Number 2, so we're going to add rotation. I'm going to rotate your pelvis to the left, and then rotate your pelvis to the right. You can switch legs, rotate to the right if you're working on both ankles, and rotate to the left. Again, I'm trying to shift my weight over as far as I can, so my pelvis rotates over, and then my pelvis rotates the other way. But my right foot stays straight, weight equally distributed through the ankle. Also, now we can start doing some lunges, so adding a dynamic component to it. So again, we're working on the stable surface. We're going to lunge forward and push back using my front leg. So I'm lunging forward and coming back. We're going to start lunging to the side, lunging out to the side. Make sure that you're using the glute as you're loading into that lunge. And coming back. And coming back. Switching to the other side, so lunge forward and back. Again, as you lunge forward, you're trying to make sure that your knee is striking over second toe and the ankle is staying nice and straight and to the side. Again, there's a lot of glute work involved here. You want to make sure that your knee doesn't go over your toes like that. You want to be tracking right over the second toe. Good. All right. Now let's make it harder and use unstable surface. So I'm using this foam pad. It could be anything. It could even be a couch pillow if you don't have it, but some sort of a foam pad works really well. So my first one is just finding my balance as I'm standing on one leg. And you can see it's much more difficult, so we're just trying to stand here for 60 seconds. Once you're able to do that, we can add head turns. Trying to look to one side, look to the other side. So 3 systems of balance: vestibular, musculoskeletal, and visual. So adding those head turns really starts addressing our vestibular system. We're taking that away, we're challenging it more. Okay, so from there, same weight shifts. Stay on one leg, shifting your weight forward and back. So again, I'm just moving my pelvis over stable leg and coming back. Good. Now we're going to add transverse plane rotation. So rotating my pelvis over that left leg. Whew. And there I am, losing my balance. It's totally fine. You just restart and then coming back. Rotate across and coming back. Good. From here, once you're able to master that, we're going to transition to dynamic lunges, dynamic components. So again, we're going to be stepping onto that unstable platform. So when I stand on my foam pad, lunge forward and come back. So I'm using my left leg, my left heel to press away. What you want to make sure is that your glute is engaged as you're loading that leg into the forward lunge. And then switching to the other side. It's always good to work both sides. Now my foot, my knee in the back is not going all the way down to the floor. I'm just hovering. So I'm feeling my glute work. I'm also feeling my quad work. All right, and then from here, we're gonna go into the side lunges. So I lunge to the side and come back in. Again, the key here is to make sure that knee is striking over second toe. And then I'm using my glute to load and press up. Switch into the other side. And you'll notice that one side is harder than the other. Oh, it's harder than it looks. All right, this is a quick progression for ankle stabilization exercises. Thank you for watching.